Welcome back. Well, every season has its potential hazards, and with summer, outdoor activities and yard work are no exception.
Dr. Mark Hodgson is here with Surgery Ltd to discuss some of the more common summertime upper extremity injuries. Great to have you here.
Thank you.
It's kind of a fancy word for like hand, elbow, arm accidents.
Yes.
Let's talk first. As we were saying during the commercial break, I said, are there a lot of people who use a lawnmower and end up with problems because, you know, people want to fix it or you know, adjust it, whatever. What kinds of injuries do you see?
That's true for a lot of different types of equipment. You know, people put their hands in running machines. Sometimes they're off and they still have a load on the engine. They turn. Snow blowers in the winter, in the summer it's lawnmowers or other pieces of equipment. Chainsaw injuries, people that are up on ladders, you know, sometimes with a chainsaw, like a tree trimmer or something like that. These
on
injuries
a ladder is bad enough, but on a ladder with the chainsaw,
It
happens.
doesn't sound good.
Circus,
Yes.
you know?
Everything you can think of has happened.
Yeah, I bet.
I believe it. So what are some of the real common injuries that you're seeing, whether it's due to mowing or using some of these, you know, pieces of
Well,
equipment?
there's equipment, there's also sporting ones. I mean, we see things, people biking that are in the summer, people that are playing soccer and running and just simple falls, which seem to be more common rather than the slip and fall from ice. They're because they're out hiking or some other activity. We see tendon injuries, nerve injuries, skin lacerations, fractures, anything involving shoulder to hand. We see quite a bit of it. They come from the ER, they come from their primaries, or they call us directly. All of the above.
Do you see more in this season, in summer, than other times of the year, or is there a season that tends to equate to more accidents?
That's a good question. I think it's more variation. I think the total volume may be similar, but the distribution is different. In the summer, we definitely see more bites, more infections, insect bites that get infected. We see some of those specific sports, baseball, softball, they're not really year-round. Basketball we see year-round, it's indoors.
Yeah, right.
But people still have injuries from all of these.
Well, it's interesting you mention bites and them getting infected, because I had a bee sting and I knew something was not right with it and went to the doctor, and everybody was making fun of me about, you don't go to the doctor with a bee sting. But I had a really serious infection, and I think a lot of times people don't realize that that can happen. It's not normal sometimes for your skin to react the way it does to insect bites, bee stings, wasps.
That's true. Any form of penetrating injury can get infected. So a bite can become a problem.
Yeah.
So what do people do if they're like Molly, they get a little bite and they can't handle it? Or just
I knew that was coming.
I know, I had to tease you, because I think that's what happens to people, and then they try and think, oh, it's no big deal, when really it is.
Yeah.
Or they have other injuries. What do? They recognize that there's something that's not right. You know it when something's not right with your own body. You come in, and what do?
Well, it depends. I mean, if you sense there's a problem and it's not getting better or it's getting worse, or you lose motion or you lose sensation and you have an injury or deformity, you're going to seek medical attention. You can call us directly if it's something that's emergent. Obviously, your local urgent care, emergency department's obviously one of the best. You can call us directly. Certainly, we can get you in the same day, generally speaking. But in your case, if you think something's not right, start by making a call. Seek advice.
And for people who have a hand injury, elbow, upper extremity, I think sometimes people wonder, well, do I really need to see a hand surgeon?
Right.
And I think because the work you do is so delicate and intricate, it's important sometimes to consult an expert like that.
Yeah, I think that's generally a good choice, but we do more than just hands. We also do forearm fractures, elbow fracture dislocations, and shoulder work as well. So, but yes, it's additional training in hand surgery. There are fellowships specifically in nerve and tendon and so forth, injuries to the hand specifically, which do provide a sort of a level of training that's not generally
available. How long did you go to school?
Too long.
Yeah. How long?
Oh, geez,
so you went 4 years?
You do the regular medical school, then you do your residency, then you do a fellowship. It's a good more than probably 10 years.
Yeah.
So it's a long time, but nevertheless,
Right.
I think patients benefit from that.
I think so
Well,
too.
when you think about, your hands, I mean, it's something you use every single day, just like a foot, you use it all the time, so you want to take the best care of it. What's the wait time in terms of, seeing you versus going, to an ER, or what we should know in terms of wait time?
Generally, I see patients routinely that call the same day for acute injuries. And I think we have a group of 6 surgeons, so we try to get people in right away. I think you have to when you have a group that large.
Yeah.
And are all of you hand surgeons?
Yes. In my group, we're all fellowship trained, American Society of Surgery of the Hand members, and
So 6 of you times 10 years in school, you got like 60 years of school.
Actually, it's 140 years of experience presently, because we have some
Yeah.
senior members that have quite a lot of experience.
That's a lot.
I think the most junior of us is now going on, that'd be probably myself, around 11 years.
Yeah.
Wow.
So
That's amazing. But I agree with Tiff, though, that this is something that you want to get fixed correctly,
Yep.
because you want your hands to work for a very long time. And a lot of them are repeat injuries or whatever. So you can consult with someone there. Here's the information so that you can make an appointment at Hand Surgery Limited. It's 414-453-7418, or visit them online at handsurgeryltd.com.
thank you.
Great
Thanks,
to see you
Doctor.
today. Thank you.
Thank you.